Hi, guys. I'm Tara Lipinski.
And this is Todd Kapisashi.
And you are listening to Unexpecting, the podcast.
Special edition.
Special edition because... Long awaited because we have a very, very special guest, Dr. Aimee, better known as the Egg Whisperer.
And, Dr. Aimee, I broke out my very hip outfit today. Ripped jeans. She said it was like Travis Kelce, which, so just so everyone knows, these aren't, you can buy jeans that are ripped. Mm-hmm. These just ripped.
I know. So, Dr. Aimee,
I didn't buy these.
You don't listen to our podcast every time, but literally Todd's wardrobe is one of the main talking points.
Well, it's because I have horrible style, and hopefully the listeners find that a little endearing. But you have amazing style, and
here I am in my sweats. But
yeah, maybe not today.
Go USA. Okay, so I feel like everyone should know Dr. Aimee just because of her presence on Instagram and the incredible work she does. And that's how I originally found her in my fertility journey 5 years ago. Just finding my infertile community on Instagram under a burner account. So I was probably messaging Dr. Aimee.
Mila Storm,
2018. But I am going to read you her intro, her bio, just sort of her introduction because you deserve it. Okay, so Dr. Aimee, since founding her San Francisco Bay Area practice in 2008, she has become the ultimate approachable expert, and I can vouch for that. She has the #1 rated fertility podcast, the Egg Whisperer Show. No hard feelings on Unexpecting that we didn't make the #1. It's okay. She deserves it. With over 3 million
We're
downloads.
Coming for you.
She helps so many women demystify complex fertility topics, and she brings so much hope and positivity to women going through fertility struggles. And again, it's all firsthand. I found her on Instagram, and I just know from firsthand experience how much warmth and how dedicated she is to not only her patients, but just to anyone struggling through infertility. So if you're hopping on and you're someone new to Unexpecting the podcast today, you're in for a treat because you're just going to learn so much. And today we're also teaming up because both Dr. Aimee and I are new partners with True Niagen. It's a supplement, an NAD supplement. And what's interesting about this is both of us, it's such an organic fit because I started taking True Niagen 5 years ago, and it was because of Dr. Aimee. So this is just very full circle. I was listening to all of her Instagram lives, her podcast, and there was one about where she talks about supplements because I think there's so many women that just want to know, what can I do to improve my lifestyle? What can I do that I can have a little control over? Because I'm sure, Dr. Aimee, you're not sure exactly when someone's struggling with fertility, there could be a million things wrong. There could be a million reasons why, but at least patients can take proactive steps to, ensure that they're putting their best foot forward. And that's what I wanted to do. And when I was listening to one, she was talking about True Niagen. So immediately I Googled it, got online, did my own little research, ordered it. And if you remember, you also took True Niagen in your little pill box every day. But we're going to get more into what True Niagen is. But Dr. Aimee, you started recommending it like 6 years ago, if I'm correct. And it was from a mice study that you read. So can you just quickly, we're going to go into other things, but we'll jump back to this. But quickly tell me about that.
Yeah, I take no credit for it. It was a patient of mine. She had done a few cycles. She was over 40 and had no blasts that were euploid, which means they passed genetic screening. Then she came back into my life after about a year. I hadn't heard from her. She was now 43 years old, and all of a sudden she had the most beautiful blastocyst. She had at least 7 and 3 were normal at 43. And I was like, holy eggs, how the hell did this happen? If I didn't know that you were my patient, I would have thought that you had used an egg donor and you were lying to everybody. And she shared with me the secret. And the secret was that she did a deep dive in PubMed, which is a doctor's version of Google, and she found this mouse study that showed by replenishing NAD+, which is what True Niagen does, in mice who weren't making it on their own, these mice actually started having babies, suggesting that it improves fertility rates, egg quality. She experimented on herself, and ever since then, whether a patient is freezing their eggs, making embryos, I don't wait for someone to have a quote unquote bad cycle and then say, oh, yeah, it looks like egg quality is an issue. I want to support a patient's egg quality throughout their journey from the minute I meet them. And it also may slow egg loss. So women who potentially take it earlier on in their life, they might have a later menopause, and that might increase someone's longevity, which for me is something that I want to do because I want to be here talking about fertility as long as I possibly can.
That's so interesting. I mean, obviously, I'm probably not going to go through any more retrievals at this point, but I'm still taking True Niagen. So I love to hear that just for, the possibility of hormonal health. And, I'm going to be 42 soon as I keep aging over here. But you know what else I wanted to ask you about True Niagen and NAD is, I was reading a lot about how it could be helpful for athletes and that there are, it's also sports safe and all of that. But how, in your opinion, how could it be helpful?
I mean, it helps with muscle and mitochondria, so I'm definitely not an athlete. I mean, I help patients with uh, egg performing enhancing drugs, not necessarily the performance enhancing drugs, obviously, that athletes use. So I'm basically like a personal trainer for eggs. But I think it has something to do with energy, ATP, muscle, mitochondria, and it can help in that way.
Interesting. Okay, so before we get more into um, True Niagen, I wanted to just kind of use this podcast as a way for me to throw questions at you that I think I had when I was, doing those deep Google searches and not finding a lot of information. And a lot of people that are listening to this podcast, either new patients or long haulers, just hearing your perspective on some of these rapid fire questions that I'm going to give you. Okay, are you ready?
Ready.
It's like a game. This is exciting.
Very.
Well, first off, before we get into that, the one question I had here, because I know this answer, but what inspired you to build a career as a fertility specialist?
So when you watch the Oscars, you're at home, you're probably there. I'm at home in my couch in my PJs, and everyone goes up, and the first person they think is their mother, and they're inspired by their mother. For me, it was my mother's journey through countless miscarriages, some of them in the late second trimester. And I lived through those, listening to her howl in the middle of the night as a young girl. And I just knew that I wanted to fix that. She doesn't cry. She's very tough. That's the only time I've heard her cry is when she went through her miscarriages. I have it in my genes as well. So my father, an OBGYN, I'm actually sitting in the same office that my father sat in for 40 years. I help patients now who my father delivered have their babies. They're now, I can't believe that I'm that old, but I've been, I am, and very proud to be doing that. So my grandfather, also an OBGYN. So it's a combination of my genetics. I was born to do this. The rumor is I came out of my mother's womb saying, who wants to have a baby? And then it was the more personal experiences that I experienced through my mom's journey through miscarriage that led me to not just be an OBGYN, but to be a subspecialist. And she always believed in me, no matter what, because as you know, going through school, medical school is very difficult. It basically took 15 years from the time I graduated high school at 17 to finishing fellowship at 32, and I went straight through, and I couldn't have done it without her support. So truly, I think a lot of it has to do with my mother's love, support, and then my family experiences through fertility issues.
Yeah, I know that story, but I thought that was so sweet. I know you haven't heard that. I just
No.
love that.
Yeah.
Okay, so down to the rapid fire. Let's start with the easy one. So misconceptions about women's fertility.
One of the most common misconceptions is getting pregnant is easy. And at the same time, another misconception that getting pregnant is hard and that you can't get pregnant over a certain age. Because as you see, you can see both spectrums, someone who gets pregnant easily and someone who has a tough journey. And that's why getting checked early is really important. Another misconception is it all about the woman. That has nothing to do with sperm. We know an embryo is both egg and sperm, so of course you have to pay attention to both things. Another thing is that endometriosis doesn't affect fertility. Well, that's a hard one for me to swallow because clearly endometriosis does affect fertility, and I think we're finally seeing doctors paying more attention to that. Another misconception is that you can get pregnant every single day of the month. Well, the reality is an egg is effectively waiting patiently or not so patiently for a sperm cell for only about 24 hours. You want me to do more?
No, this is perfect.
Well, this is the problem with having Dr. Aimee do rapid fire. Is she has so much information
Yeah.
and she's so good on like TV that she could probably do this all day.
Okay, no, that's good. So misconceptions about IVF.
That's easy. So misconceptions about IVF is that IVF is guaranteed. Another one is that it just takes one cycle. Another one that just because you have an embryo that's genetically screened means that it's going to turn into a healthy baby. Another one is that your lining doesn't matter. That's not true. Of course, the landing pad for
I have a
the
question
embryo.
for you then.
Go for it.
So lining, how important is lining and what is your sweet spot number that you like to see on a pre-lining check?
Lining is incredibly important. It's not just the thickness, but also the texture. So we like it to be over 8 millimeters, at least that's my rule. And we want it to have this beautiful, gorgeous feather-like appearance. And that's what we call the trilaminar appearance. So those are the two things that we look for.
So I know that it's different. Like you said, there's a spectrum, right? Like some people could be very young and struggle getting pregnant. And then you could have an older woman in her 40s that doesn't. But what age does a woman's fertility start to decline? And if you can give us some statistics surrounding that, just so for the people that are not that educated about it and want to know more about proactive steps that they could possibly take at their age.
In general, it's 25. So the fertility rates of a woman start to decline at 25. I mean, that's how we were made. That's human biology. But society has changed so much. So most people aren't having their first baby until they're in their 30s. And so many women now, more than ever, are having their first baby over 35 and even 40. So let's take the egg of, let's say, a 20-year-old. That egg probably has a 90% chance of being able to turn into a healthy baby. The egg of a 40-year-old has a 10% chance of turning into a healthy baby. So you can see how hard it is to get pregnant the older we get. You see a steep decline at 37, an even steeper decline at 40, and then at 43, the likelihood of getting pregnant is only about, I would say about 7% at 44. It's about 4% at 45, about 1% at 46. It's about 0.1%. So when I see a patient who's over 45, I show them so much love if they want to have a baby with their own eggs, but I encourage them to think about other creative family building options. But at the same time, if someone wants a chance, if the chance is super low, I will give it to them.
I know. See, that's what I love about Dr. Aimee, because I feel like it's so hard for women that are older that, for whatever reason or circumstance are coming to a fertility clinic and just want to try. You give the you just never know, and then you can then take the steps that follow from there. Okay. So thoughts on egg freezing then. What is the optimal age?
So it really depends on a woman's family history. For example, if your mom went through menopause at 40, I would recommend egg freezing by even 21. So talking about these things around the dinner table with your mom, I think is very, very important to do. So I recommend egg freezing by the age of 32. If it's something that you're able to do by 28 years of age, I think that's a good age. And just because you've frozen once, let's say you did egg freezing at 32, don't just think of it as a one-time only thing. Think about how old you're going to be when you're going to use the eggs, what your situation is. If you've developed any other fertility-threatening conditions like fibroids, endometriosis, think about freezing again before you run out of all of your viable eggs. So if, let's say, you're going to wait until you're 46, maybe make some embryos while you're younger just to see what the viability of your eggs is or are. So that if you needed to freeze more eggs, you at least know before you've run out. And that's like one of the regrets a lot of patients have when they come see me in their 40s is that they wish that they had frozen more eggs when they still had them.
Okay, so should we book an appointment for Georgie to fly out to you soon?
Yeah, I mean, I think, our kids probably aren't going to be having kids until they're 50. That's my prediction. So
That's so interesting. And then on that same page, when you are freezing your eggs, I think this is something that a lot of people don't know. Say you're 35 or even 30, you're freezing your eggs. How many do you have to have frozen to then, and of course it's obviously no guarantee, but what is for you good insurance of how many eggs frozen that could equal to, say, someone wants 2 children, so 2 live births?
Yeah, I'd say around 15 for someone who's 30 on average. So that would be my goal, to have at least a 50% chance of having 2 eggs with your frozen eggs.
And I'm just
2
curious, then
kids,
what
2
about at
kids.
like
Yeah.
38?
Oh, at 38, probably around 30
Wow.
to give
So that would,
yourself at least a 50% chance or more of having a healthy baby with your frozen eggs.
okay. See, I love all these statistics. I'm a huge statistics gal. Okay, so there's always a lot of questions I get about PGT testing, and I did that, and it was very important for me. That was just the choice that Todd and I made, that we wanted to do that to have that extra insurance. What are your thoughts on that?
I think it's an incredible tool, but I think it's misunderstood. I think people think embryo screening for genetic diseases means you're looking at genetic diseases, but we're not. We're only looking at chromosomes. We're not looking at genes. There's so much more that goes into a quote unquote healthy embryo than just whether it has normal chromosomes or not. And there's genes that have to be expressed in order for an embryo to implant at a certain level. We don't have those tests. So that's what's frustrating for me, is that people don't understand the power of genetic screening and the limitations. So for me, I describe it as a murky crystal ball. I also use the test results as a way to prioritize the embryos, not screen them and discard them based on the results. Because some embryos might be marked as quote unquote abnormal, whether they're designated as chaotic or mosaic or segmental, and these embryos can actually turn into a perfectly healthy baby. So my concern is that if people don't get adequate counseling and don't actually get copies of their reports before they're discarded, they could be unknowingly, unwittingly discarding healthy embryos, and they have no way of getting them back once they're discarded.
So interesting. And then what about grading? Because I feel like a lot of people have questions about that. If it's genetically normal, does grading still matter to you? And what are you looking for with that?
Of course it does. However, when I say that the more beautiful the embryo, the higher the implantation rate, sometimes people get very defensive, and they say, well, my, low quality embryo turned into my healthy baby. And I say, well, it doesn't mean that that can't happen. It just means the stronger the embryo, the higher the likelihood that it's going to implant. And this information is important for people to have so that you can plan out how many cycles you need to do. Because if you have, let's say, 2 poor quality embryos and you want 2 kids, well, you should know that quality does matter. So you have the opportunity to do another cycle if that's something that you want to do.
But how many embryos that are genetically normal, graded well, how many on ice does someone need to have a live birth? Or have, like, if their plan is 2 children, how many would you suggest?
So I've kind of been changing my answer to this question over the years. And my answer now is 6 if you want 2 kids. And I'll tell you why. The reason is this: because so many of my patients are coming to me over the age of 37. And if you think about wanting 2 kids, what happens? When you're ready for your second, you have less viable eggs. So it's much better and easier to get your embryos frozen at a younger age than find out later that those embryos did not work or implant. So I would say, if let's say you're 28 years old, maybe 4 or 5 embryos could be enough to help you have 2 kids. But if you're over 35, you might want to bank more embryos to secure, better options for yourself in the future should you need them.
That's good advice. Okay. Oh, this is interesting. I get a lot of questions about this. We only have like 3 or 4 more questions on this stuff, but DOR, obviously that's not a perfect, science either. If someone's AMH is low, that doesn't obviously mean that they can't have a child. We all know these facts. But, if someone does have DOR, for you, how long do you have to act on that? And depending on the number, obviously, and you can kind of go into that, but does it deplete each year, or how does that work?
Yeah, I mean, it depletes slowly over time. You're never standing at a cliff. There's no such thing as an egg cliff. These things happen slowly. The older we get, the faster the changes are. The younger you are, the slower they are. So if, let's say, you're 32 and your AMH is zero point 0.4, it's very possible your AMH can even fluctuate up and down and stay 0.4 even like 3 or 4 years later. But if, let's say, you're 42 and it's 0.4, it isn't unusual by 43, it could be 0.04 because of how fast things change as we get older. So the rate of change has a lot to do with the age that you're at. And so when I see a young person and I see that her levels are lower than I would expect, I talk to her about fertility preservation and just making sure she understands what her options are so that she can never look back and say, like, why didn't anyone talk to me about that?
Right. This one's for all the girls like me. So I have to ask this one. What HCG number on, say, day 10 would you say is a good start for an ongoing pregnancy? Because Todd's going to laugh, but the amount of pregnancy tests I took and the amount of HCG numbers that I've been through, it's mind-boggling, beta hell. And I think it's just interesting to hear, honest feedback on that.
Yeah, I mean, I think if it's at least 50, it's a good sign that the pregnancy has implanted well. This is the thing. I check day 8. I am the most impatient human in the entire world. We know from studies that if your pregnancy test is actually negative on day 6, there is a 95% chance that the transfer did not work. I don't know if you knew that statistic.
This is what I always felt. I always, on day 5 and day 6, I was like, if I don't see it there, this isn't good.
You're right. And so the lowest HCG level that I've seen on day 10 turn into a healthy baby was actually 9. And I've had some wild HCG rides. For example, day 8:15, day 10:15, day 12:30. What? Day 8:50, day 10:49, then day 10:150. What? So I always just say, hold on. It isn't over until it's over. And I always double check, let's say if the level's not looking as I would want. I don't just say game over, stop your medications, I'm so sorry. I just say, let's check again. And I don't necessarily make people wait 2 days. I'll just even check the next day.
Next day. Yeah. Okay. I feel like we got some really great info from you on this.
Well, what? Do I get a question?
Oh, sorry. I've just been guys.
We do this podcast.
People are going to be very upset.
She's
they're
just
not
taking over on
Okay.
this. Didn't even offer me. I know how much you love Dr. Aimee, but can I,
Yes, please get in there.
I didn't even prepare anything, but luckily I, can think on the fly. Well, so Dr. Aimee, one thing this is so off kind of topic of where Tara was at, but one thing I'm so interested in with fertility and infertility is where it's headed and where we're going to be with all this stuff in 20, 30, 40 years, 50, 100 years, it's just crazy to think about. So I guess 2 questions. One is what do you feel like is a likely kind of mind-boggling advancement that you can see happening in the next, 2, 5, 10 years? And then where do you feel like fertility, where do you feel like your job will be in 40 or 50 years? I mean, even you mentioned, at 21, people freezing their eggs. I mean, it feels like in even 20 years that will be free and everyone will do it at 21. And, that feels like where we're headed. But I'm just curious what you think on one kind of in the immediate future and then what your field looks like in, 40 years.
You're such a good interviewer.
I would say probably in 5-10 years, you're going to see doctor avatars because there's going to be so many fertility patients. And what I mean by an avatar, it's like me, but not me. And I will be interacting with someone and it'll be as if they're interacting with me. But because of AI and generative AI, they'll be able to learn how I talk, what I recommend by studying perhaps patient charts so that patients could have access to someone like me analyzing their patient chart without actually seeing me, but they think they're seeing me. And it will be clear that they're not. Is that legal? Does the Dr. Aimee avatar, AI avatar, have a medical license in every state? No, but I feel like that might be something that we'll be seeing in the future, possibly. The other thing is, I think that we're going to see a change in how embryos are genetically tested. Right now, all we do is look at chromosomes. I do think there's going to be a time, and hopefully soon, because I feel like this could be so helpful when it comes to picking an embryo to transfer, that we're going to be able to do whole genome sequencing on embryos. rather than
Wait,
just.
explain that. Explain then.
So you know how right now, like you have to do a carrier screen up front to see if, let's say, you both carry cystic fibrosis. Well, you won't have to do that in the future. You can actually see what diseases the embryo carries,
Wow.
potentially.
Wow.
It's not potentially. I think it's going to happen.
But is that also like a breast cancer gene and
Risk of breast cancer, Alzheimer's, diabetes. So I feel like that's going to be how genetic testing is going to look.
this is something that I've been thinking about. We read an article about this. It was pretty much like a uterus in a lab that could, in the future, could you potentially see pregnancies in uteruses in a lab?
Yeah, so artificial uteruses. So there are a lot of studies now looking at how that can be done, and it's in the lamb model. And there is a clinical trial ongoing in the United States looking at that, and it's being done in severely premature babies. These are babies that are pre-viable that have a high likelihood of not making it in the neonatal ICU. So that's where it's being studied right now. I follow this stuff because, when I have a patient and I feel so bad for her, I just wish I had like a closet. I can open it up and put the embryo there and have, the artificial uterus care for the baby. But I do think that that is something that we'll see in our future.
That's crazy, right? Just to think about that.
Yeah. I mean, is there anything else too? I don't want to get you in trouble, but these are just conversations we have on the podcast sometimes because I find it so interesting about the moral dilemmas potentially 50 years from now. Is there anything that you worry about that will happen that will be a tough one for human beings to grapple with whether or not we should?
Yeah, I mean, think about sperm and how sperm counts are going down so much. I think that men will, I see a situation where, your sperm count is going to be required of you to do and it has to be published. And if you're someone who produces above a certain level, you're not going to be allowed to get married and you'll have to procreate with a whole number of women. I feel like monogamy might be illegal in the future because we're not going to be able to be monogamous in order to procreate and continue on as a society. That's my prediction.
And why are sperm counts so drastically dropping?
Because we're being poisoned from the minute that we are a sperm cell, meaning that plastics are everywhere, and it has a lot to do with microplastics, environmental toxins, and the foods we eat. It's everywhere. So they're dropping so much that, in a generation from now, having sex to have a baby just won't be possible because the sperm counts are going to be too low to accomplish that. So everyone's going to have to do IVF to get pregnant if we don't do something soon.
That's crazy.
So fascinating.
Yeah.
Also, one last thing. I don't know if you have any more, and like yours were really thought provoking. But reproductive immunology, obviously, that's something that touches our story, and it took us a very long time to finally find something wrong with us. You say wrong because it was unexplained infertility. I could make these embryos. I could get pregnant. And finally we had an answer. Why do you think people are so in the fertility community? Is it just the studies that have been done, or is it just needing more time because it's new? But why do you think some doctors are so reluctant in believing that reproductive immunology issues can affect a pregnancy?
I think it's because we're brainwashed in training that it's all a bunch of hocus pocus and witchcraft and nonsense, but that's not true. Immune dysfunction at the level of the uterus between an embryo and uterus is very well studied and very well known. The problem is we don't have good, reliable tests for this. We don't have really good treatments. So that's what I think makes it really hard for a doctor. So I feel like it's almost better to badmouth reproductive immunology rather than say, oh yeah, that makes sense. Let's do some tests. But the problem comes because there aren't really good treatments for any of the possible abnormalities. I mean, there are some things that could help, but they're not perfect.
Right. And they're, it's taxing on the body. I mean, I've been through a lot and felt like I could take a lot. But when I was faced with, okay, we're going to be, pumping my body full of steroids, we're going to be doing IVIG, which, when you think about what IVIG is, and it's a blood product, obviously it's, used a lot and it's safe, but it's still, a lot to wrap your mind around.
And it's very expensive and cost prohibitive. So we're not trained about these tests. We're not trained how to guide patients through treatment, what the side effects are. So most doctors say no.
Very interesting. Okay. I want to get back into True Niagen and really help anyone that's listening that's thinking about a supplement plan to introduce them to it, because I really did take it just researching, listening to you, and I'm glad that I did. So I guess my first question would be, what is it about this supplement specifically that you believe has a positive impact on fertility support, especially for people who are wanting to have kids or children later in life?
Yeah, I think it's how it impacts NAD plus in the body and in our cells, especially the egg cell. So NAD plus levels go down as the woman ages above the age of 30, and that's around the same age as we talked about that our egg viability goes down. So by replenishing it, that can also hopefully increase the likelihood of having a healthy embryo in these patients. So that's the reason why I recommend it to patients, because of how it increases NAD plus.
And then what are some other wellness practices and lifestyle changes you recommend for your patients to help the possibility of conceiving?
Oh, that's great. That's a great question. I talk about the fertility team a lot, and that team is the number one thing that you have to have in place at the beginning of your journey, and it has a lot to do with the lifestyle and wellness practices that I'll talk about right now. So number one, the T is basically therapy. So make sure that your relationship with yourself is intact and your relationship with your partner, if your partner is also intact. This is the time to do it. I promise you, your relationship will not get better. The issues that you're having will not get fixed once you have a baby. And it breaks my heart when people have a years long journey only to get divorced because they realize that. Looking at exercise and your routine, strength training, stretching, extremely important. Going through pregnancy is like a 9-month marathon. And I have a 10-minute mile rule that I share with my patients, in which I tell them, look, if you can't run a 10-minute mile, you're not in shape enough to be pregnant. So please work on that. Acupuncture is also a practice that a lot of my patients enjoy. So it's like having another support person on your team, another, captain on your squad that's going to be guiding you, cheering you on. Then there's also sleep that's really important. So getting enough sleep. I recommend getting at least 7 hours. I know 8 hours is difficult for most people to achieve. Getting enough steps in, at least 8,000 steps a day, and then making sure that you have a mindfulness and meditation practice, whether it's listening to calm or anxiety and stress relief music, or a meditation. Making sure you have something that you can go to that will help relax you, I think is really important.
So NAD and True Niagen go hand in hand, and just maybe give us like the layman's terms of why NAD is so important, and especially important in fertility and the possibility of getting pregnant and a healthy pregnancy, and kind of break that down for us.
I mean, I think the easiest way of doing that is NAD is important in all cellular functions. And if your NAD levels are low, then your cellular functions are not as efficient. So that's why NAD can help with supporting healthy aging, supporting your cells in your skin, in your brain. And then for me and my patients, it's also supporting cells in your uterus, in your ovaries. So there are a lot of preclinical studies and clinical studies looking at how increasing NAD plus can help with egg quality. There's research now in terms of potentially decreasing risk of postpartum depression in women who take it. I recommend in my patients who have delivered a baby. It can also help with the mammary glands in the breast and help with lactation. So patients who are struggling with milk production. Are you ready for this? It can also potentially help with the granulosa cell health in women who have PCOS. So there are so many different ways that repletion of or increasing NAD plus levels can help fertility patients and in women in general, not just for women who are trying to get pregnant, but also for other reasons as well.
Well, that's what I like about it, and that's why I still take it now. And it's, obviously after my active fertility journey stopped of me doing treatment, a lot of things fell off the wagon, but this did not, because I just know that it has so many benefits beyond just what I was focused on in the moment of egg health. What about sperm health with True Niagen?
Yeah, there is some evidence that can also help with sperm health. And so I do recommend to men that they also take it. So it's part of my supplement regimen that I recommend both to men and women.
Amazing. Can you share what the supplement stack that you recommend to your patients is? Because I just know that a lot of listeners will want to know this.
Yeah, I mean, every patient is different, of course, but to support sperm and egg health, I recommend a really good prenatal, True Niagen, melatonin for patients who are doing a transfer, vitamin E and L-arginine. For patients with PCOS, ovasitol. For patients with endometriosis, they add in N-acetylcysteine. For sperm health, I also add in fish oil, vitamin D, and another supplement called Conception XR. So that's my go-to supplement stack. So
I found that from you too. That's another one he took. Okay, so obviously a lot of thought in egg health and conceiving, but then when you actually get to the pregnancy, how could NAD help support pregnancy or even postpartum?
Yeah, so pregnancy is the most energetically expensive activity the human body can maintain for 9 months. And maintaining NAD plus levels can help support health pre, during, and postpartum. So I tell my patients to take it up until their first heartbeat ultrasound. It actually may decrease risk and rates of preeclampsia, and we might learn more about that in the future. And once we do know more about that, I will be recommending it throughout pregnancy as well.
It's so fascinating, all the stuff that like in the future we'll find out. But Dr. Aimee, it was so fun being able to chat with you today. And I know all the listeners are going to be so excited for this episode.
I kind of got sad thinking that maybe someday we'll have to talk to the Dr. Aimee AI avatar.
Yeah, that
Are we
would
always
be-
going to get the real Dr.
No,
Aimee? I
Dr.
hope.
Aimee.
I don't want the avatar.
I get the VIP treatment with that. I don't get the AI avatar.
No, we won't.
Awesome. Well, thank you so much for joining us. We love you and we love what you're doing for all the women that are desperate for answers. And we're just so thankful that you were here today.
I love you guys. Thank you for having me on. You guys are so fun. Thank you for all you're doing.
Thanks for listening to Unexpecting the podcast. Please subscribe, leave a review, and follow Unexpecting Pod on Instagram for info about upcoming weekly episode releases.